everyone, and welcome back to another episode of 5 Minutes in GI, a show where we try and answer some of the most frequently asked questions about gastrointestinal disorders in just under 5 minutes. I am your host, Alyssa Sutton, and I'm the program coordinator for the International Foundation for Gastrointestinal Disorders. Today, I am happy to welcome Dr. Elyse Thakur, who is not only one of IFFGD's junior academicians, but is also the director of clinical psychology at Atrium Health. She specializes in treating digestive disorders and is on faculty with the Wake Forest School of Medicine. So I just wanted to take a moment to thank you for being here with us today.
Thank you so much for having me. I look forward to participating in this and informing you about complementary and integrative health approaches for gastrointestinal disorders.
Of course. So as you mentioned, today we're talking about those complementary and integrative health tools. These methods really do go beyond your traditional medicine, and they work alongside of it to help support your digestion and your overall gut health. So Dr. Thakur, I was hoping you could touch a little bit on some of the most relevant complementary and integrative health approaches for GI patients.
That's a loaded question. There's many different options. So we know that nutritional approaches can include natural products, dietary supplements, prebiotics and probiotics, as well as food as medicine. In addition, we have mind-body approaches. These can include brain-gut behavior therapies, which are classes of therapeutic approaches that directly target brain-gut dysregulation and stress-related pathways in the GI system. So these can include cognitive behavioral therapy and gut-directed hypnotherapy, which are among the most evidence-based approaches for GI disorders. And I'll define those here in a moment. We know that CBT, or cognitive behavioral therapy, is a skills-based approach that can help patients manage stress, improve coping, and help them to engage in effective problem solving, as well as change patterns of thoughts, feelings, and behaviors in order to achieve specific goals. Hypnosis involves a series of sessions that addresses the dysregulation between the brain and the gut, and it can offer patients an opportunity to experience deep relaxation, concentration, and focused attention, while visualizing a peaceful imagery experience and hearing suggestions about healthy functioning of the digestive tract. Some patients have questions about whether or not they remain in control through this treatment, and the answer is yes, they are in control through this entire treatment process, and many patients do find it to be a very beneficial approach for brain-gut functioning. Other brain-gut behavioral therapies, such as mindfulness-based stress reduction and emotional processing interpersonal therapies, are also emerging approaches. Other mind-body approaches can include acupuncture, which has origins in Chinese medicine and involves inserting metallic needles into identified points, or acupoints, along 12 energy channels, what we call meridians, to balance the flow of energy and life force in the system. And so this approach aims to restore this flow of energy. In Chinese medicine, this is called qi, and it appears to really modulate the nervous system, including some brain regions that might involve attention, emotion, and pain perception. There has been some research to demonstrate improvements in the GI system, as well as associated emotional health, quality of life, in addition to nausea, abdominal pain, vomiting, disease activity, inflammation. So we do find that acupuncture can be a very beneficial approach. Another mind-body practice that's been really helpful for patients, and many patients really enjoy, is massage therapy. And massage therapy not only can help with general stress reduction, but if you are specifically doing abdominal massage, that can really help promote relaxation and improve the digestive response by focusing on internal digestive organs, what we call the viscera. And so sometimes massage therapy can be incorporated into pelvic floor physical therapy, or patients can ask their massage therapist to do it specifically if their therapist is trained in this area. There has been some research demonstrating promising results for abdominal massage on GI function, but we do need more studies to really explore that further. In addition, meditative movement practices can include yoga, or what we call Tai Chi or Qigong, and those are very useful strategies for helping patients relax, as well as engage in movement practices. Yoga originated in India. It involves three main components, such as asanas, or physical postures, pranayama, which is really focused on breath work, and dhyana, which is meditation. And I recently conducted a systematic review of yoga for gastrointestinal disorders, which identified numerous benefits across a range of digestive disorders, including IBS, inflammatory bowel disease, and chronic pancreatitis, and gastrointestinal cancer. So we know that yoga can be very helpful and that the adverse effects are minimal, but there does need to be more research to fully understand the benefit of yoga for our patient population. In addition, Qigong, which I referenced earlier, originated in China, and that's another form of meditative movement that involves postures and gentle movements, which helps patients engage by focusing on mental focus, meditation, and breathwork strategies, and that really can promote relaxation as well. Tai Chi is a form of Qigong that's more of a martial art, but you may hear about this, especially sometimes you hear about elderly folks engaging in Tai Chi, but anybody can do it and lots of people can benefit. There was one feasibility study investigating a virtual Tai Chi program for patients with irritable bowel syndrome with constipation, and they actually found positive benefits. Many patients improved in symptom severity, quality of life, and even fear of food.
Thank you so much. Now that is all the time that we have for today. Please join us later this week because we're going to continue this conversation about complementary and integrative health tools. If you haven't already done so, don't forget to hit that subscribe button. And as always, if you have any questions after watching this video, please feel free to leave it in the comments below and we'll do our best to answer your question in another episode of 5 Minutes in GI.